an IV on her.
So today there's a simulation exercise,
Okay, she seems to have stopped breathing.
which allows us to show the residents and medical students how care is given in the field prior to getting to the emergency department, and allows them to truly understand what our patients go through and what our EMT and paramedics are doing in the field.
Shocking.
The first station is an out-of-hospital cardiac arrest.
Shocks delivered. Continue CPR.
The second station is an airway station where they're managing airways in the field.
All right, so let's bag her and let's see if it's in place.
The third is a disaster triage scenario.
Hey, sir. Are you awake?
There is also a station where they're going through medical control calls.
Sure, full set of valves as follows, heart rate 120, BP 90 over 60.
And the last station is performing an IV in a moving vehicle.
It's not infiltrating.
Well, it's important because patient care really starts with a 911 call, and physician involvement in emergency medical services is extremely important.
First thing that we do is we come in and maintain manual alignment.
Simulation training helps improve patient outcomes by giving our team members an opportunity to practice skills and see situations that they don't always get to see in a clinical environment. I think the big thing about simulation that not everyone realizes is it's not the actual simulation where the learning takes place. It's when they've gone through their simulated experience and then have the time afterward to reflect on it and debrief it is when people have those aha moments.
A cap refill is not perfect either.
Well, I think it's highly important for them to understand this type of medical practice. This out of the hospital experience, it does matter when it comes to outcomes and survival and public safety and benefits to a community. So I think having physicians understand this, having physicians willing to engage, again, in this, sort of different environment, I think is just highly valuable to a community.
I would rather have someone taking care of me that's gone through a lot of simulation because that shows me that, one, they're taking the time to educate themselves beyond the bare minimum. This is not something that we are required to do. And it shows that they have additional experience in things that they may not have seen otherwise in their practice.